Population Assessment for Smithtown, New York in Suffolk County, created by Christy Adornato, Bianca Coney, Rachel Guppenberger, and Julia Kenny. The Smithtown Emergency Food Pantry is in the heart of Smithtown, in the back of St. Thomas of Canterbury Parish House. 7 churches came together in March of 1984 to help feed Smithtown residents who could not afford to feed their families, with one common mission in mind: to aid residents in an emergency food crisis. They're open 5 days a week and run off of donations from various community members, such as churches, schools, Boy and Girl Scouts, local businesses, and so on. Everything is donated from the goods they provide to their advertising up through their website. Because of the generous donations, they were able to feed 2,280 families in 2014, and these numbers increase exponentially each year. They are even able to supply a full Thanksgiving dinner to their clients each year. Our group volunteered at various local food pantries and chose to focus in on the Smithtown Emergency Food Pantry. The purpose was to improve the health of the residents by supplying food to families in need. We wanted the opportunity to help feed the hungry, underserved, and marginalized populations. We chose the town of Smithtown on Long Island as our focus group with a population of 36,357. The air and water quality are rated as good, and the infant mortality rate is low at 3.9%. Smithtown is a well-educated, affluent town with a median household income of $110,000. There is an unemployment rate of 7.5%. The rate of uninsured adults under the age of 65 is 10.7%, and the poverty level is 4.7%. The third leading cause of death behind heart disease and cancer is unintentional injury, which means that many people are dying from preventable accidents. The rates of HIV and gonorrhea have decreased, while chlamydia and syphilis have gone up. Since we found it interesting that the rate of uninsured people was this high, the first nursing diagnosis we chose was ineffective health maintenance related to insufficient resources, demonstrated by a 10.7% rate of uninsured persons under 65 years of age in Suffolk County compared to a 10% rate of uninsured persons under 65 years of age in New York State. Also, having many people die from preventable accidents is alarming, so our second diagnosis is increased risk for injury related to person, physical, biological, or chemical factors as evidenced by a rate of 41 per 100,000 injuries for Suffolk County compared to 26 per 100,000 injuries for New York State. Food insecurity can lead to failure to thrive in infants, poor academic performance, and behavioral problems, as well as development of chronic diseases in children. Food insecurity can make seniors have to choose between buying food and buying medication. The U.S. Department of Agriculture indicates that 14.3% of American households were food insecure. Food pantries are a critical source of relief from food insecurity, with 1/4 of food insecure families utilizing them. If the food pantries also have nutritious food, they will help to prevent some health problems associated with inadequate nutrition intake. Public health nurses, and even community hospital nurses, can increase awareness of food resources by sharing knowledge of programs such as food pantries within the community. Essential service number 4 under the core function of policy development is to mobilize community partnerships and actions to identify and solve environmental health problems. Food pantries are developed from local community organizations, often but not always faith-based, to fill the need to feed hungry people in the neighborhood. Essential service number 6 under the core function of assurance is also in force at food pantries. This essential service is to enforce laws and regulations that protect environmental health and ensure safety. We noted at the pantries that regulations were displayed and followed to ensure food safety. The Smithtown Emergency Food Pantry is a perfect example of tertiary prevention. Tertiary prevention aims to help the community return to an optimal level of functioning and focuses on the restoration of a healthy state and rehabilitation. Anderson and McFarlane state that tertiary prevention is employed after diseases or events have already resulted in morbidity. The purpose of tertiary prevention is to limit disability and to rehabilitate or restore the affected people to their maximum possible capacities. The Smithtown Emergency Food Pantry helps its residents get back on their feet after various situations have put them down, such as loss of job or unemployment, illness, or tragedy striking the family. To improve the ability of this food pantry to serve the marginalized people in the area, I would recommend the pantry to try and bring in more healthy options, including egg, milk, and especially fresh fruits and vegetables. They could achieve this by having more fundraising events, including food drives that request specific items. They should also try to increase the amount of cold storage by using monies from fundraising or even asking for donations of refrigerator or freezer units. Another improvement would be to increase the hours of operation, especially on weekends when people are off from work.